I had to learn how not to sleep. I was a big sleeper in undergraduate, and you know, I just had to learn how to function on less hours of sleep, which is hard. But now that I've gotten through the second semester, I think I've figured it out.
So we come to ask, would incentivizing the practice of healthcare in rural areas by subsidizing the education of physician assistant students whom elect or commit to practice in those areas upon graduation aid the rural community? Well, the government seems to think so. The Federal Health Resources and Services Administration, or HRSA, granted King's College a $990,000 grant in 2010. I still wonder, however, are we doing enough?
I think PA programs in general, as well as the HRSA program, just needs to push harder to educate the students about the option. I never even knew that that existed until I started teaching here, and one of our adjunct professors who came in to lecture for us was a HRSA grant recipient. It's a fabulous way to get PAs into the rural community, help decrease their debt load, which is an incredible burden that the students have to bear. Yeah, I think 3 to 5
I
is pretty
believe
standard.
they require you to live in the community. If you're going to work in the community, I know that when I first graduated PA school a long time ago, I interviewed for a position there, and they would pay back, you know, my loans, and I would work in their community, but they also wanted me to live in the community because they stress you know, they stress that whole community interaction, which is a good thing.
Yeah.
I think that you have a really good opportunity for change and actually seeing change and knowing that you're facilitating wellness in a smaller, more rural atmosphere.
For each year a student receives aid from the grant requires students to spend 1 year practicing in an underprivileged area, rural or otherwise.
I personally feel that PAs in general are going to really take over, especially with the ACA. We're going to be filling those gaps that are left behind from the decline of, you know, primary care physicians, especially in the rural communities.
The risk of having access within the urban areas and the ease of referrals is that you're going to use a much higher amount of your healthcare dollars because you can, because it's there, and because you're just double checking, you're covering yourself, so on and so forth. Whereas in the rural areas, because it's a much greater inconvenience to order that test and less available, you're going to rely on your diagnostic skills and you're going to spend less money. If you're practicing in a rural area, you have to be considerably more reliant not just on your knowledge but on the fact that your diagnostic skills really need to be on point, because you can't just send someone down the hall for a CT or an MRI stat. The closest CT might be an hour away. So you really need to make sure that you can assess that patient based on in-office skills and have a very good ability to analyze the situation, the patient's symptoms, physical findings, and judge the likelihood of anything emergent before you're going to send that person out for that really expensive test.